Hey guys! Okay, so I'm actually updating on time for once. I had my orthodontist appointment today. Just to give a quick update in case a lot of people come across my videos and they haven't seen my previous ones. I've been in braces for about 2 years with this set of braces. I've had braces before, but I had an underbite and an open bite, so I had double jaw surgery and genioplasty, and now I have a bite that closes. So anyway, I went to my orthodontist today, and I have my guinea pig with me, Yoshi. Yoshi, say hi! He's very shy. So I went to the orthodontist today, for an adjustment, and, they checked everything out. Everything is really good, like my bite is right on, it's perfect, but the only thing is, in my two molars in the back on this side, there's a big gap between them, so they need to close that. I guess you can kind of see. It's hard to tell. But anyway, there's a big gap, so they're trying to close that before the braces come off. Just like little adjustments here and there, just to make everything perfect. There's something that they keep adjusting out here too. I don't know exactly what it is. But otherwise everything is really good. I'm still wearing elastics as per usual. And they said if I go in, next time I go in on May 2nd, if everything looks good, then I will have molds done for my retainers and the braces will be off very soon. So that'll be really nice to have that done with. Otherwise, I don't really know. I think I'm going to email my speech therapist today to see if I can start going in to see her, since my jaw is pretty healed now and I can open well enough that I think I can start speech therapy. I would have liked to start it sooner, but I had complications with this cheek after the surgery where I had that infection up in here. I think I had bone fragment in my cheek that they had to remove, so for about 3 months I had a really bad infection. So they ended up taking all that stuff out, and I had the drainage tube in my cheek for a while, then I had the big hole, and it was just really sore. So it took a while for that to heal, but now it seems to be pretty good. You talkative guy? Oh, there goes his water bottle. Hey, boo-boo. Did that freak Tommy out? That freaked Tommy out, didn't it? Yeah. But otherwise, yeah, I don't know. There's not really too much going on. So, I could be out of braces as soon as, end of spring. If I have my appointment in May, usually my appointments are 6 to 8 weeks apart. So that, June, probably July, summer, whatever. So I'll probably be out of braces by the summer then. Unfortunately, it's a little bit longer. Like we predicted 2 years, everything would be done. But it's a little bit longer than that, that's fine. Because I want everything to be as good as it can be before everything comes off. Yeah, so hopefully that'll be okay. Here, why don't you go up here? There you go. Doesn't like my desk because it's slippery. But otherwise everything's pretty good. I think I said in my last video, I can open this much now. But I still feel, it's like still tough to open, and I hear a lot of cracking, especially on this side. This side's the one that's been the most trouble for me because I had the underbite on that side. The woman at my orthodontist office who was, doing the adjustment today, who took everything off and all that stuff, she was looking at the old pictures from prior to the braces and surgery of my bite, and she was saying that, that side was just like awful. I had like no teeth touching, and it was really bad. Like my bottom molars were so far ahead of my top molars that I had no contact at all on this side. So I have never really used this side to chew. That's something I'm trying to get used to, being able to chew on both sides of my mouth now, because it was for so many years, I couldn't chew on that side at all. I could only chew on this side because I didn't have any contact with my teeth on this side. I only had one molar touching on this side. So it's a lot better now. It's really weird having like a full bite compared to how it was before. It's a huge difference. But my bite is pretty good right now. It closes like perfectly. It's hard to believe. Like when I watch the older videos of me prior to jaw surgery, I don't know, I just find it like really so weird to look at myself and see how I used to look and see how bad my profile was compared to how it is now. It's like, it's pretty crazy. And honest to God, there is no way that you can prepare yourself for going through a surgery like that and for the outcome of it, because I don't know, for me, I had double jaw surgery and genioplasty, so I had a lot of movement. Like everything from here down is completely different now. Even I noticed my eyes have changed because my cheekbones are in a different position. Like they're more noticeable now. My nose changed from the surgery. So I look at my old videos and I don't really recognize myself. Like I remember looking like that, but unless I see a picture or video of it, I've gotten used to my new face. Thank God. Like, I don't know, I feel more comfortable now with myself, and I feel really comfortable having a side profile that isn't convex, because now my side profile is like normal, when for a long time I had the convex and my chin was really convex, and now I have like an actual normal chin, which is amazing. I don't know, it still amazes me, but I'm really happy. My nose is straight too, because my nose was really crooked before the surgery, but I guess when they fixed my jaws with however they move my jaw, because I had a cant, which means that like your teeth are like this, like straight, and mine were like, I guess, a little bit like that. There was one side higher than the other or something, so they fixed that as well. So I guess maybe that's why my nose is straight now and I don't have one side pulling down like I did before. But I know a lot of people, you know, you're going through the whole thing where you have your bite problem or you have like whatever orthodontic problem and you don't know whether or not you should go through with the jaw surgery to have it fixed. It's a huge thing to go through, I can tell you that much. Like for me, I didn't think it would have such a huge impact on my life as it actually did, because I found like it was really hard to prepare myself for it, and the time coming up to jaw surgery was just so hard to get my head around it, and I was really nervous, and that was just pretty much my whole life was jaw surgery. Like I was just thinking about it all the time, and I had to take time off for recovery. And after my surgery, I kind of went through a huge identity crisis where, I don't know, it's like you go to sleep and you look one way and you wake up and you look like a different person. It was really hard for me because this surgery isn't cosmetic. Like it's not a surgery in the sense like, oh, I'm gonna go get a nose job. This is like something, it's like structural. So you do have changes like you would with a cosmetic surgery, but there are so many other reasons behind it. I had such bad TMJ issues. I couldn't chew because my teeth weren't making any contact. I was just having so many issues because of my jaw that it got to a point that I wasn't having the best quality of life that I could. Where are you going? Come here. Probably wants to go back into his cage. But yeah, it was a lot to go through, but I'm really happy I did it now, and I'm so happy with my face and everything, even though I'm still completely numb down here. And I'm still pretty stiff. Like in here, I guess because of all the scar tissue, I'm pretty stiff. But I notice it gets better over time, so I'm sure it'll improve over time. I'm just trying to think. I'm seeing my surgeon in a couple months, because now my appointments are getting further and further apart, and I'm seeing the orthodontist in just under 2 months, so that won't be bad. But I'll try to update. I'll try to update like in a month. If I don't, then I'll update, I'm sure, around the time that I go for my next appointment, and see if the braces are coming off. And once I have my braces off, I'm going to do a video where I'll take like clips from everything and I'll put them all together to show like the whole change from the beginning to the end. But I'll do that once the braces are off. Okay. Yeah. Okay. Want to say bye, Yoshi? Say bye. Say bye. Oh, like he's saying bye. Okay. Bye, guys. I'll update soon. Bye.